We are here at the LV Prasad Eye Institute in Hyderabad, an institution that has achieved a unique world record, 50,000 corneal transplants since 1987. That's a world record. I have with me the founder chair of LVPEI, Dr. GN Rao. Congratulations first of all. 50,000 may be a number, but when you say no waiting list of corneal transplants in Andhra Pradesh, Odisha and in Telangana, that's amazing. How did that come about?
Well, when we got started, I was a trained corneal surgeon when I moved back from the US to start the institute. So from day one, we wanted a cornea program because there was no strong cornea program anywhere in the country at that point. And one of the limiting factors was the availability of transplantable donor corneas. The eye banking system was in a rudimentary stage. In the entire country in 1987, there were only about 7,000 donated eyes, and only about 3,000 or so corneal transplants were being done. But the demand was for that we need to do at least 100,000 transplants a year in our country to meet the requirements of corneal blind. So we started putting all the essential ingredients in place. The first was, while we were thinking about eye bank, we started the cornea service. We recruited people with excellent training in corneal transplantation, or we recruited youngsters who came out of their postgraduate programs and trained them ourselves. That's how we built our surgeon team and the paramedical team. The second component was the eye bank, very critical. In 1989, I approached, even the first 2 years we were trying to kind of convince some American eye banks to help us. And one eye bank in Baltimore, led by one Mr. Frederick Griffith, was convinced because he was encouraged by one of our Indian corneal surgeons there, Virendra Nirankari, to work with us. He said, they will make it happen. Frederick, you work with them. So Frederick agreed, and with their help, we got our technician trained. They gave the blueprint through the philanthropy of local philanthropists. We got started with the eye bank. And it turned out, I didn't realize it, that was the first international standard eye bank in all of Asia. There was none in Japan, there was none in Singapore, Hong Kong, none of these advanced countries.
And it is still the largest in the region?
Yeah, largest. And initially the donation was minimal because we were looking for voluntary donations. And then we built the eye bank team, the technicians, the managers, grief counselors. So then we adopted the American system, what made it very successful in the US. The system called Hospital Cornea Retrieval Program. By using trained grief counselors to counsel the bereaved families at the time of death and convince them about the positive aspects of eye donation. We started at Nizam's Institute. The then director, Dr. Subbarao Kakarla, in 1 minute, he consented for us to start the program there.
So you had people stationed there to talk to
wherever
the availability may have been.
Yeah. And then we spread to other hospitals, Osmania, Gandhi, several hospitals, both government and private. And through that, the entire system of eye banking was built up. And along the way, we started adopting all the current practices in eye banking, constantly up to date. Several American eye banks collaborated with us. So that was kept up. And we built capacity in the country by training technicians for other eye banks, by offering capacity building programs, going and helping them. All that happened.
You were mentioning 1 lakh is the demand for every year. And yet the gap is still huge. What are the big challenges you're seeing? You spoke about the multiple stakeholders that you've built as an ecosystem.
Today, if you look at the number of trained corneal surgeons in the country, probably about 1,000. We probably trained between 35 to 50% of them. They're spread all over the country. but a lot of them are not doing transplant surgery actively. The biggest barrier is availability of corneas. What we have achieved in these 3 states, unfortunately, is not replicated. The simple principle is, if you have too many eye banks, everybody hangs a board outside with an eye bank, then everybody will fail. Fortunately for us, we have created one big eye bank here, and nobody else is interested in these states to create parallel ones that could have hurt everybody. Because we supply everybody whatever their requirements were. And we have actually surplus, and we supply to the rest of the country. And that could happen in everywhere if there are central eye banks in all the major cities. For our country, there is a simple principle: 50 eye banks is all that we require for the entire country. We require many transplant surgeons, but not eye banks.
So you're saying the limitation is not actually the talent availability in terms of the surgeons, but it is the availability of corneas itself.
Yeah. And then the legislation that makes it easy for these surgeons to operate. In some states, they're so stringent, for them to get permission to be able to use their talent takes a long time. Maharashtra is a classic example. Considerable delays in everything. Sometimes their policies are all have to be thought over. They would not allow
this would also be covered under the Human Organ Transplant Act.
But
eye transplant would have been the simplest among
but unfortunately, what they did for Human Organ Transplant Act does not apply to eye banking, because there is nothing really in common with their other organs. But we have been trying to modify that through legislation for 30 years, but still hasn't happened. So that's the biggest barrier. And then the surgeons not actually getting in there and beginning to operate. So you have to change the thinking of the public about the corneal transplant and eye donation. You have to change the thinking of ophthalmic professionals that indeed corneal transplants are successful and they should refer their patients who need it. And the third is policymakers.
So does that mean Maharashtra may be among the smallest numbers in terms of even eye transplant, corneal transplant?
Why is it Bombay having a waiting list? Tell me, with so many big hospitals there. Why is Delhi having waiting list? Why is Chennai having waiting list? They should not. So the big government hospitals in all these places could easily start these programs. If you have 500 major hospitals in the country with grief counseling programs, with full-time grief counselors working, we will be an exporting country for corneas in 3 years. That simple step, if government can do, and support the salaries of these grief counselors. And the capital for 50 eye banks is an initial capital investment of a paltry 50 crores for the whole country.
Wow. And such a shame that we are supposed to be the largest population of preventable blindness. So each of our viewers actually can be a change maker in that sense, a visionary who can gift eyesight. Tell us about what every person can in that sense do. I know technology wise, I want you to touch upon that as well. Earlier we used to say you have a window of hardly a few hours. Now you have storage solution that gives you a much longer window, which is about 4 days or so.
So anybody can be a donor of any age group. Then they screen the history of the person, medical history, and sometimes decide certain individuals may not be suitable for donation. We tell them that. But otherwise, just about anybody can donate eyes. The second is once the corneas are taken within ideally 6 hours after the death, but it can go up to 12 hours if they are kept in an air-conditioned environment. And after that, the cornea can be preserved with the media available in India. There are 2 types. One is for up to 96 hours. The other is up to 10 days. So there is plenty of opportunity, and anybody can donate. It can be preserved, and it can be sent all across the country. We need a central distribution system with first come, first serve kind of thing for surgeons. And everybody should have access to the corneal tissue.
You have been chair of the International Agency for Prevention of Blindness and have been part of the Global Vision 2020 document. What is the dream about lab-grown cornea? Is that something that is, we are seeing it as a reality in the near future?
Yes, we are doing it here. We recently 3D printed corneas. We are now thinking along the lines of not total corneal transplantation, but each layer can be transplanted separately. So that is in the works now, and hopefully in 5 years you will see the realization of that in clinical practice.
And where does that stand in the global stage or your research?
I think we are one among at the forefront of that research at this point in time, along with a couple of American labs and maybe in Singapore and Japan. But otherwise, we are way ahead of the rest of the Asia and the country in this aspect. But I think there's a lot of promise in that area. So again, I go with the simple thing to the government, 50 eye banks, right? 50 crores investment, 500 hospitals, corneal grief counseling program, and then you can have 500 active practicing cornea specialists doing 200 transplants each year. India will have no treatable corneal problem.
Fascinating. Thank you so much, Dr. Rao. So, Dr. Rao giving us the solution as well, the visionary that he is telling us the road ahead that the government can take to stop any of these preventable blindness can become any kind of an impediment for people. So, whoever can be cured of blindness should be cured, and that is the road that Dr. Rao is showing us. In Hyderabad with camera person Nagaraju, Sudhir, NDTV.